Hello, everyone, and welcome back to another episode of NF2 and You. This is a fantastically exciting short podcast series we're doing to provide information on a range of issues that affect people with NF2. I am absolutely stoked today to be welcoming Dr Anke Hensiek today, and she is a neurologist from the Cambridge NF2 team. Anke, thank you so much for joining us today.
Thank you for inviting me.
Excellent stuff. No, we are covering quite a huge topic today. I mean, this seems a very, very hot topic for NF2ers, not just at the moment, I think quite broadly. We're talking about neuropathy today. Now, we've got a lot to unpick, so I'm going to throw straight in with the first question. I think neuropathy sometimes can seem like quite a vague term, So can you explain a little bit about what neuropathy is? I mean, is it an umbrella term for a different range of nerve issues? Can you tell us a bit more about that?
Yes, so neuropathy, if you translate the word, it basically just means an illness of a nerve. And so, judging by that, one could think that anything that happens in the nervous system could be covered by that term. However, practically speaking, most people, when they talk about neuropathy, they refer to a disease of a specific part of the nervous system. And so I think in order to understand what that is, it might be helpful just to remind ourselves how our nervous system is structured. And so when I explain this to people, I usually compare the nervous system to a computer with cables. And so obviously the main computer, which is like where everything is happening and where the decisions are made and where the impulses generate, is the brain. So that's the most precious part of our nervous system. Okay. The brain, because it is so precious, it is really well protected in the body by the skull. So it's a bony surrounding. And then the nerves connect the body with that main computer. So the nerves are like cables. Okay. So the cables from the brain, there are some cables from the brain which directly connect the part of the body that's above the neck. Those are separate nerve cables that leave the brain directly, and they are called cranial nerves. However, the majority of the nerve cables for the body and everything that's below the neck initially travels down through the spinal cord, and then from the spinal cord those nerve cables exit and connect the body with the rest of the nervous system. So the spinal cord is a place where, again, the nerves are really, lots of nerve cables are kind of bundled up together. So it's a precious part of the nervous system. And again, it's protected by bone. It's protected by the spinal column. Okay. But once the nerve cables then leave the spinal cord, they're not protected by nerves anymore, by bone anymore. And so when we think about the nervous system, we divide it up into central nervous system, which is all the parts of the nervous system protected by bone, so the brain and the spinal cord, and peripheral nervous system, which is the nerve cables that connect the body with the central nervous system, and the cranial nerves. And so most people who talk about neuropathy really refer to a problem of the nervous system that is not the central nervous system. So it is either those peripheral nerve cables that connect the body once they have exited the spinal cord, or it's this cranial nerve cables that, supply everything above the neck. So it's just those nerve cables which provides a connection. So that's what a neuropathy is.
Wow. I mean, sometimes you have to be just absolutely in awe about how the body works, and particularly how the brain works, you know, and just that connectedness throughout the entire body. And I think, you know, because people use neuropathy and peripheral neuropathy so interchangeably, I'm really glad you clarified that for us. So thank you very much. I think the key question from that is, when we're talking about peripheral neuropathy, which is, I'm assuming, something that affects NF2 more, is that correct in saying?
Well, I have to say, so most people, so basically we have established what a neuropathy is. But within that umbrella, so it's a disease affecting those peripheral nerve cables. Within that umbrella, there are also a lot of differences of what can happen. So the most common disease affecting those nerve cables is what people refer to as peripheral neuropathy. And a peripheral neuropathy is essentially a degeneration of those nerve cables, which usually starts at the end of those nerve cables and gradually creeps up. So this is like, it's a disease which doesn't just affect one nerve cable, but which affects all of them. And it starts with the longest nerve cables. It degenerates at the end. Our longest nerve cables are in the toes and in the feet. And people who have a peripheral neuropathy have symptoms which start usually in the toes and then gradually creep up the legs. And sometimes also the hands can be affected. That's by far the most common cause of neuropathies. It's a generalized peripheral neuropathy. This can happen in NF2, but it is very rare to happen in NF2 in my experience. Okay, so what happens in NF2 is usually something else, which is damage of those nerve cables, but not in a kind of gradual degenerating, more systemic way, but specifically affecting only specific nerve cables, and often it's nerve cables where, you know, tumors are located on. That's much more common in NF2. So as I said, once
Sorry to interrupt there. It's interesting that you say that, because I mean, if you think about other conditions that have peripheral neuropathy as a symptom, so I'm thinking, for example, of like I think diabetes and MS. Those seem to be a very degenerate side of the condition. Is that accurate? And then whereas NF2 is more of a specific cause and targeted area of the nerves, but with something like MS, that would be a more wide-ranging,
well,
degenerate thing.
MS doesn't really cause a neuropathy.
Right.
So,
Okay.
MS is a disease of the central nervous system, of the spine and the spinal cord and the brain. So MS doesn't cause neuropathy. So neuropathy only refers to a disease of these cables. But you are right. There are the most common neuropathies are neuropathies where those nerves just degenerate. And this can just often happen in people as they get older. It often happens in people who have vitamin deficiencies, for example, or diabetes or other diseases. And it's a degenerative process which starts at the nerve ends. In NF2, it is also described to happen, and I've got 1 or 2 patients who have this type of neuropathy to a severe degree. However, it is, in my experience, quite rare to have a generalized peripheral neuropathy. What is much more common in NF2 is that you have these nerve cables as they exit the spine, and that in these nerve cables you have schwannomas, and those schwannomas affect the specific cable where they are located on. Or, for example, the nerves often bundle up, those nerve cables often that go to the arm or the leg bundle up before they go and do the proper connection. That's called brachial plexus or lumbosacral plexus. So sometimes people with NF2 have tumors in the brachial plexus or in the lumbosacral plexus. And these tumors affect the function of the nerve cables where they are located on. But that's different from having a generalized neuropathy, which you see in diabetes or vitamin deficiencies, where the nerve cables actually just degenerate at the end. If you know what I mean.
And so it would be accurate to say then that in NF2 it is the tumors that cause this neuropathy specifically then?
Well, as I said, in my experience, this is the most common cause. However, it's not only. So some people also have a more generalized neuropathy of the type you see in diabetes or vitamin deficiencies. But in my experience, that is less common. It's not that common in most people. Where you have symptoms of a neuropathy, you can see that there is a tumor somewhere affecting the function of that nerve.
So what are the sort of common markers of neuropathy? How would someone experience, or how would someone know that they were experiencing neuropathy?
So it's very, as I explained in the beginning about this function of the brain and likening it to a computer, it really works very similar. So the nerves work through electricity, and each nerve cable has a specific function. Okay, so usually those nerve cables which are affected by neuropathy provide the electrical signal to a muscle and tell the muscle to move. And also they confer information about sensation back to the brain. Okay, so for example, if you burn yourself and then the pain you experience is, it's, you know, those peripheral nerves sense the pain and feedback to the brain so that you experience pain in that specific area. So each of the nerve cables which we have, which may be affected by a peripheral neuropathy, provides the electrical signal to a specific muscle or to a specific area of the body in order to confer the sensation. And so if you have a neuropathy, obviously that function is lost because the nerve cable is damaged. And so what you would normally see is, you would normally see a loss of function in the distribution, particularly transferable to the nerve. So patients may have weakness in that distribution, or they may have sensory loss. But the sensation that is affected, it's not only always sensory loss of sensation, so numbness is very common, but some people also develop alterations of sensations. So rather than just numbness, the sensation just becomes abnormal. So for example, one thing that people often complain of is pins and needles, or funny sensation, or tingling, or it can be painful. Or they may perceive, touch suddenly as painful, or the temperature sensation can be altered, those kind of things. So basically loss of function, usually affecting motor function, so weakness and abnormal sensation in the area that is supplied by the nerve cable that is affected in a peripheral neuropathy.
So going back to what you said earlier, you were obviously talking about the systems of the central nervous system, so, and then how that connects to the peripheral nervous system. So is it right in thinking that if neuropathy is sort of experience with weakness in the arms or weakness in the legs, is that specifically tumour related to the spinal cord or to the spine, or could that be tumours presenting elsewhere in the peripheral system?
So usually the peripheral nerves, the nervous system, in the way it is defined only relates to these nerve cables. And in NF2, very often to tumors specifically on these nerve cables. So, for example, if somebody, what is very common in NF2 is, let's say, having spinal tumors, ependymomas, for example. Those ependymomas obviously affect the neurological functioning, and they cause weakness and they cause sensory loss, but you wouldn't refer to that as a neuropathy.
Right, okay.
So that's not a neuropathy. A neuropathy, if we're just talking today about neuropathies, so a neuropathy is really restricted to the peripheral nervous system or the cranial nerves. So it's a different thing. And in clinical practice, we can distinguish that. We can just look at somebody and we can look at the pattern of weakness they experience, and we can look at where exactly this loss of sensation is, or the abnormal sensation. And then you will know that if you see a neurologist, they often check your reflexes. Okay, so from checking the reflexes, we can say if the problem is localized in the peripheral nervous system, so it's a neuropathy, because in those situations the reflexes are often absent, or if it's in the central nervous system, in which case the reflexes are often increased. So
just briefly touching on ependymomas then. So damage from ependymomas, that's different from neuropathy. Yeah. So how would that be described? Just a sort of spinal cord damage, or how would that be described?
Well, I mean, if you, as I said, the kind of, if we talk about what is a neuropathy and what do people mean when they refer to as a neuropathy, most people would think it's the peripheral nervous system. But it depends on how you define neuropathy. If you say neuropathy is anything that damages the nerves, then ependymomas would fall under that. But that's, I think, not what we're talking about today. So obviously an ependymoma damages the nerves, and it causes weakness and it causes loss of function. But that loss of function and that weakness is not caused by damage to one of these nerve cables as they exit the spinal cord, but it's caused by spinal cord damage. So, and the symptoms one experiences as a result, and the neurological examination findings are different from what you see in individuals who just have a neuropathy.
Right, okay. Because I think we all go through.
And for many people who suffer with NF2, it may be also academic, because they say, it doesn't really matter what causes my weakness and my numbness and my pain. What I'm interested in is my symptoms.
Yeah.
But for us as doctors, this is the way we divide it up, because for us, often in NF2,
I think clinically.
No, so it's very difficult for us to say. A lot of people who have bad NF2 have lots of tumors everywhere. And so it is important for us to know which of these many tumors is causing what. And so by doing a physical examination and trying to localize the problem somebody has to a specific individual nerve, in terms of the distribution of the symptoms, that often really helps us to know what's causing what.
Right. So if someone had a whole investigation and it was found to be attributed to a specific nerve, would their symptoms only be concentrated to that nerve, or would they experience symptoms in surrounding areas as well?
Well, so if that nerve was not functioning, but all the other nerves were functioning, then they would only experience symptoms in that distribution of that nerve.
Okay. So One of the things that we see talked about quite a lot when people are talking about neuropathy is pain. And is this something that's always experienced in neuropathy, or is it just one of many symptoms with it? I know you briefly touched on symptoms, a moment ago, but I'm curious as to whether pain is always involved in it.
So actually, the vast majority of people who have a neuropathy do not experience pain.
Interesting.
So they experience loss of function and numbness that is more common than pain. But some people can experience pain because the nerves are responsible for pain sensation and sensory transmission, and that can sometimes be painful. But in the majority of cases, I'm not sure, a lot of people with NF2, for example, have these big brachial plexus tumors and things, and it's much more common just to have weakness and numbness as a result rather than pain. So it's often not painful. What is more likely to be painful is, for example, if there's a tumor pressing on something, that can often pain. Okay, and then there are certain nerves where, if they are affected in NF2, they're more likely to react with painful sensations, like, for example, the trigeminal nerve. If you have a trigeminal neuropathy, then that's often painful. But for the peripheral nerves, I think whilst pain can occur, it is not one of the very common symptoms, and many people don't have any pain from a peripheral neuropathy.
Well, actually, I'm just going to quickly go back about trigeminal nerve and the issues around that, because we see quite a few people talking about trigeminal neuralgia. Is that a type of neuropathy, just in a different place? And is that experienced in sort of the same way?
Yeah, so it's a type of neuropathy because, as I said, the neuropathies affect those nerve cables once they exit the central system. So it's from the spine, the nerve cables, but from the brain you have separate nerve cables which are called the trigeminal nerve, which exit directly from the brain and provide everything above the neck. And the trigeminal nerve is one of these cranial nerves, one of these nerve cables, as is, by the way, the eighth cranial nerve, where the vestibular schwannomas are located on, which occur in NF2. But the trigeminal nerve is a nerve which is responsible for the sensation of the face. And it is quite common that when something touches that nerve, that the result is that people have this kind of electrical shooting type of pain. Okay, so we see that sometimes in NF2, sometimes from the other tumors, the vestibular schwannomas or other tumors, cranial nerve tumors in NF2 might touch the trigeminal nerve. Sometimes that nerve is also closely located to a blood vessel. The blood vessel might touch on the trigeminal nerve. And so anything that irritates that nerve, it's just like, when you go to the dentist and he hits a nerve, and you get this kind of neuralgic severe pain. It's like the abnormal electrical signal causing.
That's interesting, because I honestly, until I think early last year, I hadn't even heard of trigeminal neuralgia. So that's really fascinating to understand that a little bit better,